Robert Tamukong. I'm Associate Professor of Clinical Pharmacy here at the department, and I also coordinate all postgraduate training, Masters and PhD in the Department of Pharmacy. So about clinical pharmacy, which is something very new in Uganda, it's one of the very first programs ever to be implemented in Uganda. Traditionally, pharmacists were people who were thought to be pushing drugs behind the counter in community pharmacies. So there has been a paradigm shift from that approach for pharmacists to go from product-centered to what we call the patient-centered model. It means they don't take care of only medication, but they are also part of an interdisciplinary medical team in terms of their knowledge in drug therapy. So, in other words, a physician would diagnose a pathological condition or a disease, and then the pharmacist would diagnose what we call a drug therapy problem. And together, they can work for a better outcome of the patient at the end of the day. So talking about the pandemic that is here with us today, it came in as early as the late 2019 and more so early 2020s. It's been a challenging time for us here at the university, especially in terms of our clinical pharmacy unit. But at the same time, we were privileged as a clinical unit to be able to be allowed to stay put, because we are patient care providers, we are clinicians, and we have to be trained to be able to work within the confines of a pandemic. So it was just right for clinical students to stay on board and continue delivering service at the level of the hospital. So that was a big deal because our patients and even the staff over there at the hospital, the Barara Regional Referral Hospital, were very appreciative of the services that were offered, especially that the number of students had dwindled significantly, and it was challenging to meet the demands of the hospital. So the difference that we are experiencing with this COVID time is that we're able to, as much as we keep our students around, we're able to deliver a lot of the modules virtually. But as you know, it's a challenge because this is a hands-on program, it's a patient care program. So it was a little bit challenging trying to blend both the virtual aspect of the teaching together with the hands-on. So it was a little bit challenging, but we managed to weather that through, and the students as well were very appreciative. Another challenge was keeping the students on campus for all that while. As a matter of fact, during the second lockdown, but I just want to say here that my students have been around since December of 2020. Up till this time, 2022, they've been here trying to catch up on the curriculum. And at this time, they are more on their clinical program. We call it experiential exposure, their clinical rotations in the hospital. And we are hopeful that we should be able to complete the program on time. In terms of opportunities, the Department of Pharmacy in general had made significant strides with the support of PharmBioTrack, which is a World Bank funded project under which we belong. We made significant strides, notably at national and international level. I just want to dove my heart to Associate Professor Ogwang Patrick, who is the head of Department of Pharmacy here. So under his stewardship, we were able to come up with the celebrated drug today, the magic bullet, Covidex. And that was really a big achievement for the department. We also were able to come up with what we call the FAMSAN, which is basically hand sanitizer that has helped not just the university, but other institutions around Mbarara and Uganda as well to observe the SOPs for COVID. So Mbarara University of Science and Technology is a great university, and our programs that we offer here are very unique. And in the sub-region, the East African sub-region, actually, clinical pharmacy here is one of the programs that is very significant. So we have international students. We have students from Ethiopia, we have students from Kenya, we have from Tanzania, we have from Rwanda, from Congo, from Benin. So it's actually Africa in miniature that is coming into the program, and we encourage people to continue to apply and come into the program. We are really, really happy that we are able to sell these programs to the outer world, and we encourage people to come in. They will not be disappointed here in Mbarara.